Hello everybody, Dr. Del Millers here with personalfitness.com. Hope you're staying safe and I hope you're staying healthy out there. Today I want to talk to you about why excess weight weakens your immune system, increases your risk of serious illness from viruses like COVID-19, and make a vaccine less effective. That's right. You see, the gyms are closed and we're spending more time at home. And for most people, this is a recipe for weight gain, undoubtedly. Now, over the past couple of months, I have personally spoken with at least a dozen people who have gained anywhere from 15 to 40 pounds since the start of this pandemic. That is not good. See, this is not good because over 75% of Americans were already overweight or obese before this pandemic began. And if you're already 20 pounds overweight, gaining another 20 pounds may have just put you in the obese category. See, since this pandemic began, dozens of studies have reported that many of the sickest COVID-19 patients have been people with obesity. In fact, just being overweight puts you at a higher risk of COVID-19 complications. Now keep in mind that when I'm talking about obesity, I'm not just talking about someone who weighs 200, 300, 400 pounds. You could be in the obese category if you're carrying 30 plus pounds of fat on your body. And if you're carrying all that extra weight around your midsection, you could be abdominally obese. Now, you're abdominally obese if you're a woman and your waist is greater than 35 inches, 40 inches for a man. Now, why can fat around the waist create so much trouble? Abdominal obesity increases your risk for heart disease, diabetes, and increases your chance of serious complications due to COVID-19. You see, visceral fat, the fat around the abdominal area, is like an iceberg. It's different from the fat in other parts of the body in that it grows deep within your abdominal cavity and fills the space between your organs. Visceral fat around your organs is dangerous because not only does it impair the functioning of your organs, it also increases chronic inflammation in the body. And chronic inflammation could lead to insulin resistance, which leads to heart disease, diabetes, stroke, and some cancers. Not good. But here's the really bad news. Chronic inflammation can make it much easier for the COVID-19 virus to get into your cells, which leads to severe complications and in some cases, death. Now, talking about visceral fat can also affect your breathing. Why? Because fat in the abdomen pushes up on the diaphragm, causing that large muscle which lies below the chest cavity to impinge on the lungs and restrict airflow. This reduced lung volume leads to collapse of airways in the lower lobes of the lungs, where more blood arrives for oxygenation than in the upper lobes. Therefore, with a COVID-19 infection, you're going to get worse before you get better, which is why most overweight and obese COVID-19 patients end up on ventilator. They can't breathe. In addition, immunity also weakens in people with obesity, in part because fat cells infiltrate the organs where immune cells are produced and stored, such as the spleen, bone marrow, and thymus. As a result, you end up losing immune tissue in exchange for adipose tissue, making the immune system less effective in either protecting the body from pathogens like COVID-19 or in responding to a vaccine. This is primarily because key immune cells, such as T cells, don't function as well in the obese state. They make few molecules that help destroy virus-infected cells. And we have learned over the years that the traditional flu vaccine don't work as well in patients with obesity. This probably has a lot to do with the fact that the immune response is altered due to the excess weight and the severe chronic inflammation. Excess weight can also lead to chronic low-grade inflammation. This is because fat and immune cells secrete several inflammation-triggering chemical messengers that sweep in to clean up dead and dying fat cells. The bottom line is, folks, excess weight impairs your breathing, your body's immune response and increases inflammation around the body. And if you watch my webinar, you'll learn why chronic inflammation leads to more COVID-19 virus getting into your cells, which is the primary cause of severe illness and death. So if you haven't watched my latest webinar, Why Your Metabolic Health Matters More Than Any Vaccine, you can find the sign-up link at personalfitness.com. In the webinar, I talk about the 5 simple steps my clients over 50 are using now to lose weight, balance their hormones naturally, build robust immunity against viruses like COVID-19, and to feel sexy again. Who doesn't want that? So for those of you who need assistance with any of those things I just mentioned, your first step is to watch the webinar. Go to my website, personalfitness.com. You'll find the link to the webinar. Sign up for the webinar. That's the first way I can assist you. Secondly, you can sign up for a free health strategy call with me. Who doesn't want to get on the phone with me? It's a 1-hour coaching call, folks. It's a free 1-hour coaching call. And on this call, it's an hour where you get the opportunity to clarify where you are and what you would like to accomplish. Explore what's going on with your body and your health, uncover possible solutions, and then figure out how best to close the gap between where you are and where you want to be as quickly as possible. So if you've watched one of my webinars and you're ready to build great health, you're ready to get your sexy back, you're ready to build robust immunity against viruses like COVID-19, you're ready to balance your hormones naturally, you're ready to lose that weight for the last time. If you're ready for all that, if you're ready to reduce chronic inflammation around your body, if you're ready for all that, just go to my website, personalfitness.com, and sign up for a free health strategy call with me. If you haven't watched one of my webinars, get out there, sign up, watch the webinar. I guarantee that 30-40 minutes will be well worth your time because it's very informational and you're going to learn a lot about COVID-19, how it gets into your cells, how it gets into your body, the science behind COVID-19, and what you can do to build robust immunity, folks. I'm Dr. Del Millers, and until next time, may the best of your todays be the worst of your tomorrows. Catch you on the other side.